This conference will now be recorded.
अद्य शनिवासरः अथवा मन्दवासरः श्रावण शुद्ध पंचमी नागपंचमी इति लोके दिनांक 25 जुलै 2020 सहस्रयोगम गुग्गुलादि तैलम शंखं चक्रं जलधां ददतं पृथगतं चारुदौर्भिश्चतुर्भिः सूक्ष्मस्वच्छातिहृद्यां शुकपरिविलसन् मौलिमम्भोजनेत्रं कालाम्भोदोज्ज्वलाङ्गं कटितटविलसच्चारुपीताम्बराढ्यं वन्दे धन्वन्तरिं तं निखिलगदवनप्रौढदावाग्निलीलम् प्रौढदावाग्निलीलम् ब्रह्मणो हि समारब्धामात्रेयाद्येषु पूजिताम् अस्मदाचार्यपर्यन्तां वन्दे गुरुपरम्पराम् आयुर्वेदरतं वन्दे माधवाख्यं महागुरुम् आयुर्वेदामृतं सर्वं शिष्येभ्यो यः प्रदत्तवान् द्रष्टाज्ञानी दृष्टकर्मा कृतकर्मा तथैव च अध्यापको दुषक्श्रेष्ठो महान् संशोधकस्तथा गुणैरेतैः समुदितैः यत्कार्यं प्रतनोति सः समृद्ध्यर्थं हि कार्यस्य वयं न प्रयतामहे सरस्वत्यै नमो यस्याः प्रसादात् पुण्यकर्मभिः बुद्धिदर्पणसङ्क्रान्तं जगदध्यक्षं ईक्षते आत्रेयं प्रथमं वन्दे आयुर्वेदजगद्गुरुम् आयुर्वेदामृतं सर्वं गृहीत्वा हि सुरेश्वरात् अग्निवेशादिकेभ्यो यत् प्रयच्छत् मुनिसत्तमः प्रथमं तन्त्रकर्तारम् अग्निवेशं नमाम्यहम्। अद्य नागपञ्चमी इति लोके अयं दिनम् अयं दिवसः तावत् चरकजयन्ती नाम्ना प्रख्यातोऽस्ति। तर्हि अग्निवेश कृते तन्त्रे चरकप्रतिसंस्कृते चरकमहर्षिणा अथवा पतञ्जलिना यः अत्र प्रतिसंस्कारः कृतः अग्निवेशसंहितायां तस्य कृते ममापि अभिवादनम्। So this particular day is celebrated as Charak Jayanti, and this might be that this is his the avatar of Sheshanag, and on the occasion of Nagapanchami, it is celebrated as Charak Jayanti. So we all bow before Bhagwan Patanjali, who is in disguise of this Charaka. योगेन चित्तस्य पदेन वाचां मलं शरीरस्य च वैद्यकेन योपाकरोत्तं प्रवरं मुनीना पतञ्जलिं प्राञ्जलिरानतोऽस्मि. So I express my gratitude towards Charaka, and we go ahead. गुग्गुलमरिचविडङ्गैः सर्षपकासी सर्जरसमुक्तैः श्रीवेष्टतालगन्धैः मनःशिलाकुष्ठकम्पिल्लैः उभयहरिद्रासहितैः चक्रितैलेन मिशितैरेभिः दिनकरकराभिर्तप्तैः कुष्ठं हृष्टं च नष्टं च. So as I said, this is a peculiar yoga which is due to Surya Santapa, and this is a simple way without Agni Samskara, but when there is Atapa Samskara, of course, that creates heat. So anyway, this is a good part as such. एला युग्मतरुष्ककुष्ठफलिनी मांसी जलध्यामकं स्पृक्काचोरकचोचपत्रतगरस्तवणेय जातिरसाः. शुक्तिव्याघ्रनखौ मराभमगुरु श्रीवासकं कुङ्कुमं चण्डा गुग्गुल देवधूप कपुरः पुन्नाग नागाभयम्. So this Eladigana is famous in Ashtanga Rudhaya. Eladiko Vatakapha Vishancha Viniyachati Varna Prasadana Kandu Pitaka Kotanashana. So the Falashruti is also the same. There is no difference. So Ela Yugma Sukshman Bruhat Ela Tarushka Shilaras Liquid Amber Orientalis Miller कुष्ठ फलिनी प्रियंगु मांसी जल वालक ध्यामक कतृण रोहिष स्फिट्टा तृण विशेष असबर्ग डेल्फिनियम झलिल अतिच एंड हिम्स 1 चोरक चोचत्वक पत्र तगर स्थवणीय जाति रस शुक्ति व्याघ्र नख अमर अमरावदेवदार अगरु श्रीवासक श्रीवेष्टक कुंकुम चंद चंड गुग्गुलु देवधूप खपुर कुंद्रुक शल्लकी निर्यास पुन्नाग नागा व नागकेशर केरते available. So Eladi Churna, Eladi cream, Eladi Tila and Kerate, Eladi Taila. So cream is also available. I was not aware. So Eladiko Vatakapha Vishancha Viniyachati. So this is good for Vatakapha and Visha. Varna Prasadana. So the cream can be applied for Varna Prasadana. Pandu Pitaka Kotanashana. So Pitaka and even for Kotha, this is a good thing. So Shita Pitta Kotha Udarda, allergic urticaria. So this is good. Yes, cream is available. Kera Tailam is used in cream. Okay, so that is, of course, coconut oil is also AVS. So this is good. So if it is readily available, we might try to see. And so Vishanashaka is one of the important aspects over here. And we may try to use this for this particular reason, even for Kotha, Kandu, Pidaka and Kotha. This is a good choice as such. I've used it for this particular purpose and it works fine. So we may have to think about this, and this is readily available. That is another important aspect. Nishoshiradi Taila. Nishoshira Balakvatha Tailam Eladi Kalkitham Siddham Abhyanga Yogena Pitika Meha Sudanam. Okay. Nisha Ushira and Balakvatha and Eladi Kalkita Abhyanga Yogena Pitika Meha Sudanam. Is this available, Nishoshiradi? Do you have any idea? So this is also a simple part. Of course, we need to have Kalkadravya from all Eladigana. So with Nisha, Ushira and Balakvatha. Vranakarma also Eladi. Yeah, that is another important aspect. The Elam Eladi na Kuryat, that is what has been said about Vranakarma in Parmeha for non-healing wounds or ulcers. So therein also I am using Eladi tail to great extent, and in these are having Sugandhi Dravyat. Eladi Gana is having Sugandhi Dravyats. So Sukshmatva is more there. Available Vaidya Ratna. Okay, so Nisho Shiradi, this is also fine. Of Kottakala, Kerala. Okay. So anyway, this also seems to be a good part. And Pitaka Meha Sudanam. So particularly for Prameha Pidaka, this might be used externally. And Meha Roga. So we may try to use this in diabetic neuropathy, etc. Though the medicines are not very well Vata Shamaka. Balak Vata is, but Eladigan itself is Vata Kapanashana. So this might be a choice for Abhyanga, particularly in diabetic neuropathy. So we may try to think about that. Ashtapatra Taila. बिल्वङ्कारस्करदलं भ्रामरं शक्रवल्लरी सामृतं नागवल्यग्रं पटोलामलकं तथा आसुत्य द्विगुणक्षीरं तैलप्रस्थं विपाचयेत् अष्टपत्रमिदं तैलं शिरोरोगविनाशम्. Okay. बिल्व कारस्कर विषतिन्दकदल भ्रमर भृङ्ग शक्रवल्लरी इन्द्रवारुणि अमृतागुडिक्षी तत्र नागवल्ली अग्र पटोल अमलकिपत्र स्वरस द्विगुणं क्षीरं तैलप्रस्थं विपाचे. No Kalkadravya. Asutya, what is the meaning of Asutya? Asutya would really mean Asava Prakriya, but it doesn't seem to be over here. So maybe these patras are kept in water for some time overnight or something. And this should be two parts and Taila should be one part and Shira two part. So here he is taking only Svarasa. Is this available? Ashtapatra Dala. Ashtapatra Taila is also available from Dhanvantari Matam, Ayurvedic Private Limited, Trivandrum. Parathuvalia, Ayurved Pharmacy. Okay, Valia, Ayurved Pharmacy. May we see what is the Hindi translation of this? But to me, what I feel is one may have to soak these leaves in water overnight, and this water to be taken two parts, Shira two parts, Taila one part, And maybe the kalka of all these, when you take out the water, whatever remains that the kalka has, that may be taken and Ashtapatra Taila may be prepared. Shiroroga Vinashanam. The Falashruti is also strange, and in which Shirorogas and how to use, maybe just Shirobhyanga, that might be the thing. But Khalati, Palita, Shiroruja, and brain tumors. There are so many varieties of Shirorogas and such. Or if we look for Ayurvedic diagnosis, Surya, Vartardha, Vedaka, and there are many Mataja Shiroroga, etc. And why specifically Patra? That is yet another important aspect over here. Maybe think it can be used for Nasya. Possible. Nasa Ishwarasodvaram. So anyway, that might be acting on through Nasya as well. Anyway, we may have to see whether it has some effect on Pranava Srotas and such. I was remembering something from Vaidya Pansarkar that these are the lungs of plants, leaves. The whole process of taking carbon dioxide and releasing oxygen is being done by the leaves, and so the patra can be used in pranavasrotas particularly. And the moola, particularly of a tree, has the function of absorption of the ahara rasa in the intestines. So this is acting on intestines. That was his thought process. So maybe think of this, but here it is Shiroroga only, and maybe try to use it in tumors, either malignant or non-malignant. Meningioma is a non-malignant, and glioblastoma, astrocytoma, these are malignant tumors. So I've come across many such cases, meningioma and astrocytoma and glioblastoma. Uh, maybe we use for Nasya and maybe for Shirobhyanga. दारी स्वरसादि तैल दारवी सर्वसे यष्ट्या व गृहधूम निशायुतम तैलम अभ्यंजनात् पक्वम मेढ्र रोगम विनाशय. So दारवी स्वरसादि यष्ट्या व गृहधूम and nisha. So bit strange dravyas, and this is particularly for Medra Roga. This is also very strange. So, which kind of Medra Roga? Again, this is a question. Actually, we are not seeing many patients of Medra Roga as such. I have treated a few cases of cancer of penis, and generally people come to us only after surgery. So, gynectomy is done, and then only patients come to us. But this might be, there are Shuka rogas associated with penis as such, and just Abhyangana. You may have to think. Secondly, as I said, There is no much mention about Avayava in Ayurveda as such. There are two totally different views, one of conventional medicine and that of Ayurveda as such. So the functionality is associated with doshas in Ayurveda and to certain extent dhatu and mada, whereas the functionality is associated with the organs in allopathy, conventional medicine. And more importance has been given to the structure of that organ and the particular system in which it is involved and the functions of that system that have been elaborated. So whenever we are finding references like this associated with a particular organ as such, it is important for us to integrate this thought with the conventional medicine for diseases of that particular organ as such. So we have Shukarogas, which are very rare. I have not seen a single case of Shukaroga. And therein this might be of help. So Grihadhuma Nishaharitara. Now it is very rare to get Grihadhuma in cities. In villages, this is still available. But wherein chulha is used, they can. Paraskara Patra do have any Visha effect. Bija is Visha for sure, but Patra may be mild Vishakar. Might be, I am not aware. Bija is definitely Visha, but more use is of Karvira Patra that is seen, that is also poisonous, but that is generally used for external application only, not internal. So this we may have to think if we are going to put drops of that into notes. So anyway, this Medraroga is a peculiar thing. Amrutottara Taila. गुडुच्चा विपचेत्वाथे तैलं क्षीरसमन्वितं चन्दनो क्षीरकुष्ठाब्ध सारिवामलकोत्तलैः कल्कैरेभिः शिरोदाहं पित्तगुल्ममपि ज्वरं प्रमेहं विनयन्त्याशु नाम्नैतदमृतोत्तरम्. So Gudichikwath Tailam Kshira Samandvitam. Taila and Kshira to be in equal quantity. Chandano Shira Kushtabda Shariva Malakot Palaihi Kalkaihi Ebihi. So Chandana Ushira Kushtha Musta Sariva Amalaka Utpala. These are to be used in Kalka. And Shirodaha Pitta Gulma Jvara Prameha. So Falashruti is also wide. I think this should be available, Amrutottara. So Tola each Tila Taila 1 prastha, Guruchi Kwatha 4 prastha, Kshiras 2 prastha. So I don't know this tradition of using 6 times Dravadravya. Tailam Kshira Samanvitam, so I thought that Taila should be equal quantity with the Kshira. Here it is making 1 plus 2. So Kshira 2 prastha and Taila 1 prastha. So this is contradictory to what the part says. Or we may just say that Kshira Samanvitam Tailam. May neglect the summer aspect. Taila and Kshira to be prepared. And Guduchikvatha. So Guduchikvatha twice and Taila Gurta Kshira twice of the Taila. That might also be one thing. Otherwise, if you are going to take one part of Taila and one part of Kshira, Then Guduchi may be taken 3 parts. Then it becomes 4 times. And Kalkadravyas to be taken 1/4 of the oil. चंदन उशिर कुष्ठ मुस्ता सारिवा amalaka utpala. Yeah. So these are 7. So 14 tola. And 1 prastha is 64. एक, दो, तीन, चार, पाँच, छः, 7. So it is 16 or something like. Maybe it is difficult to calculate if you want to take 1/4. But still, I doubt about this. Maybe this is a tradition. We may have to look in Malayalam part how what they do or something, and may then try to understand. So Shirodaha, this is one of the important indications. Pitta, Gulma, Jwara and Prameha, also called as Guduchadi oil. I don't think so. Is it available Amrutottaram Tailam? Nobody knows about this. Pitta, Gulma, Jwara, Hindi book. Okay. But whether it is available by the name Guduchadi oil? Yes, available. By Amrutottaram or Guduchadi oil? Amrutottara. Okay. This is basically for Pitta and good for Prameha. Uttara means what? Uttara is more in quantity. So the preparation in which Guduchi is more, that is Amrutottara. So only Guduchi Kwatha, milk and this Kalkas. So alone Guduchi is used in Kwatha, that is why it might be Amrutottara. Amrutadi oil by SNA Aushadashala. Okay, is it something we should increase gradually? Don't think so. Because this is the nomenclature of the Taila and it is associated with Guruchi itself. That will be when we, while doing Prayoga, if there is a mention that we have to gradually increase like Vardhaman Pippali, etc., then it will be that meaning. Right now, from Sanskrit, this won't be the meaning as such. चंदनादि तैल चंदनोदीच्च नलद धात्री यष्ट्याव सारिवाहा सबला सलिल द्रोणे पृथक दशफलोन्विताः पक्वा कषाये सक्षीरे क्षिपेत् ब्राह्मी वरीरसम् कुमारी नारिकेलाम्बु तैलमानं पृथक् पृथक् प्रपौण्डरीकमञ्जिष्ठा धातकी पद्मकेसरम् कुमुदोत्पलशालुक मृणालविसपद्मकम् अनन्ताकुशकाशेक्षु क्षीरि शृङ्गं सवल्कलम् गणञ्च जीविनीयाख्यं पाथे द्रव्याणि पेषयेत् प्रस्थञ्च दत्त्वा तैलस्य शनैर्बुद्ध्वग्निनापचेत् एतत् तैलं प्रशमयेत् दाहमूर्च्छा शिरोग्रहान् कामिलाढ्यरोगं च रक्तपित्तं च नाशयेत्. Quite big part. चंदन उदीच्य नलद धात्री अष्ट्याव सारेवा सबला सलिलद्रोणे पृथक् दशफलोन्विताः पक्त्वा. So every one to be taken in Dashapala and Salila Drona. Kashaya Sakshire Kshipet. And then Brahmi Vari Rasam. Kumari Narikelambu. Tailaman Pruthak Pruthak. So Brahmi one part, Vari Rasa one part, Kumari one part, Narikalam one part, Taila one part. कुमुदोत्पल शालूक मृणाल विसपत्नकम अनंताकशकाशे क्षीरी शृंगम सवल्कलम गणंच जीवनीयाख्यं पाथे द्रव्याणि पेशे प्रस्तंतु दत्ता तैलस्य शनैर्मृद्वग्निनापचेत् दाहमूर्छा शिरोग्रहान् कामिलाम् आढ्यरोगं च रक्तपित्तं च नाशयेत्. Let us see the part. प्रदरं चित्तविभ्रंशं विसर्प पित्तवैकृतम् अभ्यङ्गपाननस्याद्यैः हन्ति वज्रं विवास्वा. The Falashruti is quite wide. प्रपंडरिक मंजिष्ठा धात्विकी पद्मकेशर कुमुद उत्पल शालूक कमलकंद मृणाल बिस्व पद्मक अनंता यवास कुशकाश इक्षु शीरी शृंग and Valkala जीवनीय गण द्रव्य 1 तोला each. तिलतैल 1 प्रस्थ. चंदन उदीच नलद जटामांसी धात्री यष्ट्याभ सारिवा बला टेम्पलेच जल 1 द्रोण. Prepare चतुर्धावशिष्ट कषाय प्लस क्षीर 1 प्रस्थ ब्राह्मी स्वरस 1 प्रस्थ शतावरी स्वरस 1 प्रस्थ कुमारी स्वरस 1 प्रस्थ नारिकेलांबू 1 प्रस्थ. So these are already 5. The Kvatha and the Kalka. Daha Murcha Shirograha Kamala Adya Roga Raktapitta Pradara Pitta Roga and Visarpa. So particularly Murcha and Shirograha, these are typical. And in Pitta Pradhana Avastha, this might be a choice as such. Or Nasya in Murcha. So Chandanadi oil is available, and I have not used it widely as such. Shirogra is one of the important aspects in meningitis, and I have to come across only 1 or 2 cases of meningitis as such, acute meningitis. So maybe thought about this. And Kamala and Murcha together, this is again important. There are patients of particular form as such. Chitta Vibhramsha. Yeah, it is in the Sanskrit shlok as well. Why he has dropped it, I don't know. So Chitta Vibhramsha is also one of the important indications. And Nasya, this should be a good thing. And even in Pradara. So we may try to give Nasya in Pradara. That is another important aspect. Vaidya Bhairarao Gautam was using this Chincha gold and gold hota. नस गुळ होता ना in Pradara. Anyway, this is a different issue. Abhyangapana Nasya Dehi, so we can take even Basti also in this by Adi word. But since in Pusavana there is a specific role of Nasya, Anidra used for Shirak Pichu or Talam used in Pradara for Nasya. So Ganesh, you put it to all, not only to me, so others can see. Reply to or ask to all. So what I feel right now is I was talking about the role of Pusavana and in which Nasya is important. So this has some connection with the uterus, etc., or the garbha, this particular way. Now people try to link it with pituitary, and there are cases of pituitary cancer or pituitary adenoma, which is non-malignant, but still there is a tumor in pituitary gland. So I have come across cases with pituitary either carcinoma or this adenoma and adenocarcinoma. These are two things. So maybe we try to use this. And even for Chitta Vibhransha, this might be a good option. I am generally asking to go for Mahakalyana Kristanas. But this seems to be a better choice if we want to go for Nasya as such. And in Anidra, use for Shirapichu Talam. Okay. So this is again a different aspect that the disease is somewhere and the treatment is somewhere. Nasya in Pradara, this is a totally different aspect, but we may try to use this and then that will be better. So, anyway, I think this is a better choice. All are Shita Virya Dravyas. And again this question of the Drava Dravya to be used in different pathas. Sometimes there is some mention, but otherwise this is more traditional as such. Looks like traditional, and people are following it like that. Mashamudga bala siddham tailam sarva shiravtinu. Also, all kinds of Shirorti. And Masha and Mudga together is quite also important. So Mashadi tail might be available. Nasya and Garbhashaya must have some relation in the Nasya done in Garbhini causes Garbhasanga, Garbha related problems. I guess mentioned in Tika of Anarha Rugnas of Nasya, I guess. But for Pusavana, Nasya has been given. There is no doubt. Later on, you may not put Nasya. That is definite. So you can definitely go for Pusavana. And but this relation of Nasya and Garbhashaya Vikar or something like that. This is something very great. Nasya in Pradhara is usual practice with Chandanadi Ksheravela, Ikshek, Mahakalyanaka Krute in some cases when all treatment fails. Nasya works. The relationship is of Udana Vyana Prana, maybe Avarana to Apana. This we may have to think about the relationship between this kind of effect of Nasya on particularly uterus as such. And I remember one point. In conventional medicine, there are ovarian hormones which have a control by pituitary gland. I had one case long back. ऋतुकालात नस्य करू नये काश्यप. Okay. Then many days are lost. Yes, sir, but do the work on Chandra and Surya Nadi in Bhusavana. This is a good thought that Chandra and Surya Nadi that is associated with male or female like that. And I mean, that's it. Hypothalamus pituitary ovarian axis is allopathic concept. That is true. But this particular thing that pituitary has control over the ovarian hormones and in threatened abortions, if the progesterone level is low, giving just progesterone doesn't work. If you give HCG, then it works. That is the experience of many gynecologists. So they have to work on pituitary as such. So what I feel, I had one case long back, 18, 19-year-old girl, didn't get menses till 16th, and they went to allopathic doctor. He started with hormonal pills, and then she started getting menses, but this went on for 3 years, and they ultimately made courage to ask the doctor how long we have to take this. Then he explained that hormones are not getting created in your body, so there is no way you have to continue with this. And then further told that don't marry, you will not have children. So the girl and her mother wept over there in front of that doctor, then came to me and again cried for 15-20 minutes in front of me. I said, look, we have a different approach, but I will try to understand what is the allopathic view about this. And I asked one of gynecologists, and he said what the doctor had said is partly true, partly incorrect. So there are no hormones getting generated in the body, that is true. But she should marry, and she has to be started with HCG injections so that there will be ovulation. Then catch that ovum and go for IUI, IVF, etc. And of course, this is going to be expensive, and success rate cannot be said. But with mechanical procedures like this, she may conceive. Like that was what his say was. So, if we have access to these things through Nasya, there is no concept of Nasya. in conventional medicine for this. Only internal medication and particularly the injectable form is the solution according to them. But how do we think about this? The Shira and this particular avayava. Sarvendriyani yenasmin prana yeshu samshrita yaduttamanga mangana shirastadabhidiyate. Shall we relate it with the karmendriya? Though there is no mention about the karmendriya as garbhashaya as a karmendriya. It has a specific karma. There is upastha. But for pleasure aspect, if this garbhashaya is also working for ananda, that is karmendriya, so we may have to think of that. Anarthava due to shoka or dukkha nasya mahakalyana dukkha. Raja pravrutti started in menopausal syndrome. Mahakalyana nasya work alone works better. So this is also found. I had one case of brain tumor. Lady at the age of 35 or so. Her menses stopped completely, and she went to allopathic doctor. Surprisingly, he advised MRI brain, and then there was revealed that there was a tumor, and that was the cause for her amenorrhea. Now the tumor was deeply seated, and surgery and other things were risky, or radiation, and she was reluctant to go for that. So she came to me. We started with milk diet and medicines, and next year when we did repeat the MRI, the tumor had not increased. It had remained the same. She didn't get menses. Now she is continuous with me for last 4 or 5 years. She has not stopped the treatment. It is now a bit irregular. But there are still no menses, and nothing happened. No symptom due to tumor. Generally, they will get epilepsy or diplopia or some other defects. So this is again an important case. How do we correlate with this Shira and this Garbhashaya like that? And particularly this amenorrhea or something like that. So if it is helpful in amenorrhea, this might be helpful in brother as well. So what happened to that case further? Does she conceive? No, she had already 2 children. So there is no issue of conception, etc. She is not getting menses. And initially there was so much resistance from her, from husband, from family to not to go for surgery or radiation. Only thing, there was a risk factor, and she was somehow convinced to continue only with my treatment. So, and now this still remains a question because surgery has not been done, histopathology has not been done. So whether it is malignant or non-malignant still remains a question. And if we present the case, then the first question will be asked will be this one. And whether the tumor has reduced or whether the tumor has disappeared, that is another important aspect they would be asking. But I said, let us continue with the treatment and see whether she gets menses. If she gets menses, then we can say that it has worked. But till 5 years, she didn't get menses. In hypothyroidism, if brother is complained, then Nasya can be used. Nasya. Definitely we can use. So this is a totally different aspect, how to deal with these cases. And whether Nasya is important. या ठिकाणी पूर्व इतिहास गर्भस्रावाचा असेल तर फर्स्ट ट्रायमेस्टर पर्यंत प्रतिवर्ष स्वरूपात देता येऊ शकते का पुत्रस्थिती प्रदान? वी कॅन डेफिनेटली गिव्ह. Generally, this nasya is started from 6th to 8th week. Early the better. If you start for Kumsamana, then you start from 6th week onwards and at least continue till 8th week. So, Bali Purushakara hi Daivamapyati Vartate. If the Purushakara is strong, then it can supersede the Daiva and there can be a male progeny, particularly in cases wherein all 4, 5 earlier deliveries are female only. Only thing is one has to be cautious about this. There are laws very strange from Ayurvedic point of view about this. Kandalokadaka Nasya is mentioned in Vaishya Ratnavali for better breast development in menarche avastha, I guess. So relation of Nasya with Stana and Garbhashaya. You have to see the reference. Now, underdeveloped breast is also a common entity, and this has something to do with the Shukra Dhatu as such. But surprisingly, for Stanavruddhi, the medicine is to be given is Tanyakara medicine. So, one which is responsible for Stanya Janana, that medicine is to be given for Stana Pushti as such. Now, this is a naturally occurring phenomenon during pregnancy. Amleshtata stanopinav sastanyam pushnachuchiko. This is the description about that. So, stanopinav, this happens due to pregnancy. But if we are getting cases before this, before marriage or before conception as such, then this is quite troublesome. So what I feel is there is connection of this Rasadhatu, Stanya is the Upadhatu of Rasa, and Shukra as such in these conditions. But may we use this if there is a mention of Tandula the Kanasya, then we may use this particular thing in that situation. And secondly, we may look for other characteristics of Shukra Sara. So Mahasvichascha, this is again one of the important symptoms in Shukra Sara as such. And in Mausakshaya also there is Sphic mentioned. So Shushka Sphic Udara Griva, this is again a Lakshan with Karshya as such. So in that scenario, if there is underdeveloped breast and this Sphic also is not Pushta, then we may have to think of Shukra and Mausa both. Not thinking only of Rasa, but Shukra and Mausa both. So, as I said, Krusham Prayo Vidhavanti Rogashya Grahani Gataha. That is one of the important sutras. I was treating a case of Grahani. I used Sorana Parpati. The patient improved as far as the symptoms are concerned. But there was a stagnation. And then I asked Panchalkar sir, and Panchalkar sir said, go for Ashwagandha the Abhyanga, Ashwagandha Taila Abhyanga. And that improved him further. So he was looking at it from Grahani point of view. And of course, the original disease was Grahani only. So we may have to think about this interrelation between Dhatu and a particular Avayam and a particular function of that Avayam. This is a very big topic, and maybe we look at it from medicine perspective. This is again a different aspect. So a particular procedure, a particular medicine is acting in a particular place and having effect somewhere else. Apana, Prana, Udana modulate each other. Basti and Nasya both indicated in Pakshaghat, Vandhyatva, Rajodosha. That is another important aspect. that Basti treatment is more important, particularly in all these. But as we have the Ananda of Upastha as a karma, we may think of this Ananda in ladies for the Yoni and Garbhashaya or something like that. And Nasya effects up to Vakshas. That is another Skandagrivasya Vakshasaha. That is the thing. So Nasya might be directly helpful in breast development, as what Meshija Ratnavali is saying. Kafaja Grahani, Strishu Aharshanam. Yeah. So, as I said, Shushkaspi Godara Grivo. This is again one of the important aspects. And this fig, as I said, is associated with Shukra, it is associated with Mausa. And so we may have to think about these factors in treating these cases of Sagrahani or any other diseases. एका केसमध्ये सेकंड डिलिव्हरी नंतर स्तनाचा आकार खूप कमी झालाय, म्हणजे पूर्वीच्या नॉर्मल पेक्षाही खूप कमी. तर इथे विचार काय करायचा? So what I feel, you just have to think about this. If it is after delivery, Rasa might be an important aspect over here. And as I said, there might be a role of Shukra and Mausa. Harshana is increasing Shukra and thus having good effect on this Shukra karma. On the contrary, Chinta, Shoka, etc., Bhaya, they are all reducing Shukra or creating impotency. And that may adversely affect, if it stays for a prolonged period, that may affect the formation of avayavas, this particular organs and such. So we may have to think about this and try to counteract it with Harshana. That is another important aspect. Now there are many cases of breast cancer. And besides whatever treatment that we are offering for cancer as such, there is a big psychological shock. If you go for mastectomy or radical mastectomy, modified radical mastectomy as such, MRA, then losing this particular part, is a big trauma as far as the sexual life is concerned. And if this is happening in young age, I have cases right from years 20 onwards of breast cancer. There are cases after menopause, but maybe we think that after menopause it may not be adverse, having very adverse effect. There is no concern about this in conventional medicine. At the most, they can go for reconstructive breast surgery, that is one thing, or artificial breast. But whether this is going to have psychological effect or not, this is again the big question. And what happens to their sexual life later? Say a lady may be having one or two children and getting breast cancer at the age of 35 or 32 or something like that. And then getting mastectomy done, MRM done. I'm not aware whether anybody has done any research on the psychological aspect and urge for sex, etc. in this condition. I've come across a few cases who have undergone mastectomy or something, and later on they conceived. They didn't have any child. So this is again, according to conventional medicine, this might be dangerous, and it may provoke cancer once again or something like that. So there are many issues associated with this, and particularly psychological aspects are not considered at all. So this we may have to think seriously about that. Anyway, we conclude today and continue on Monday. आयुर्वेद प्रकाण्डो निगदित इह हि शल्यतन्त्रप्रधानः शिष्येभ्यः शाश्वतोऽयं निखिलजनकृपा व्याप्तचित्तेन येन आयुर्वेदस्य वाञ्छन् पुनरपि भुवने तां च सुष्ठु प्रतिष्ठान् श्रेष्ठं धन्वन्तरिं तं प्रणमति च सदा वैद्यवर्गो वैद्यवर्गो हि नूनम् पुनरपि चरकमहोदयेभ्यः नमस्कृत्य चरकमहोदयेभ्यः धन्यवादान् दत्वा विरमामि. While giving basti, we consider pakvashaya as the root or base of tree. While giving nasyam, we give importance to brain like base of tree as it controls the body. Urdhvamulamata shakam ashwattham prahuravayam. This is one of the important sutra from Gita, Bhagavad Gita. We have to think about that. Charak Jayanti. So we bow before Charak and conclude this session.